hopefully you can hear me. Hold on a sec. I gotta turn off my air conditioner. Sorry about that. All right, so I'm coming live today, and I have to say I'm wicked annoyed already. I literally just spent 20 minutes trying to find an area of my house that had good lighting so that you could see my face without glare. So this is the best that I could do. Not to mention the fact that my husband's in the living room, like, singing, even though I said I'm on a live, so please zip it. So I don't trust him, and my dogs are also there, and they're always barking, so therefore I'm sitting in here by myself, like literally sitting in my bedroom on the floor to do a live. So the title of this video is I got my lab results today, because I did. I get my labs done pretty much every 6 to 8 weeks for my thyroid, because as I mentioned previously in another post, I'm almost 3 years out of thyroid cancer, and my thyroid levels are still always off. So I'm happy to report that my TSH is actually therapeutic for me today. It was 0.618, so that's great. And then my T4 was 0.75, and my T3 was 2.44. So just with that being said, I'm happy about that. And so hopefully the current dose of WP thyroid that I'm on will stay, and hopefully I'll be able to get it from the pharmacy, because as I mentioned in my video a couple days ago, if you guys missed it, go check it out, that this particular medication, WP thyroid, has been the best medication so far. It's the cheapest, it's the most purest, and for whatever reason, can't get it from the damn pharmacy. So I swear it's a conspiracy, and it's all about money, but I'm not going to go there right now. I'm not going to get on that little spiel. But my topic today is Hashimoto's, because I was going to go over it yesterday, but I just talked about hypo and hyperthyroidism. Then I had to jump off to go to my son's practice. So basically, I just wanted to touch upon what actually Hashimoto's is, because not a lot of people realize what it is. Hi, Katie. How's little Jackie Poo? Hoping he's recovering. Anyway, so Hashimoto's thyroiditis is an autoimmune disease, and I should say that I'm not a physician. I am a nurse practitioner. I'm not a physician, but everything that I talk about, I kind of talk about from educating myself and also living it, living and being. And I think there's no such thing as a better experience than just kind of living it. So Hashimoto's thyroiditis, it's basically an autoimmune disease, and it's like, oh, I got a thumbs up. I don't know who did that, but so it results actually in the destruction of the thyroid cells. And so you have I think 90% of the people who have hypothyroidism actually have Hashimoto's, and it's actually on the rise. I think like 10% in the United States is increased in the past, like, I don't know, 7-8 years. And then for every 7 women, there's 1 man who has it. So it's basically a woman problem. And it's thought to be because of hormonal fluctuations. Thanks, Jerome. Hormonal fluctuations, because a lot of it, you know, the symptoms can occur like right around puberty, pregnancy, and menopause. So that's why it's thought to be more hormonal. So basically, people who have Hashimoto's, it's an autoimmune disease. So if you if you already suffer from an autoimmune disease, such as like diabetes type 1, where you don't produce any insulin, celiac disease, rheumatoid arthritis, things like that, you're more predisposed to something like Hashimoto's. It's also genetic. So my poor daughter, I tell her that all the time, because she's always saying, Mom, I feel tired. Oh, I think it's my thyroid. So I'm like, Kylie, it very well could be, because honestly, that's how I felt growing up. So it is genetic, and if your parents or your mother suffer from some kind of thyroid disorder, then you're definitely predisposed, especially women, because you're hormonal, you know, especially around those peak times of pregnancy and menopause. Yesterday I actually mentioned too that a lot of women miscarry without even realizing that they're pregnant. Like, you know, first of all, you might not know that you're pregnant, and you have a miscarriage, you're not even aware of it. Or other people who are in their pregnancies don't even realize that they're hypothyroid or Hashimoto's and have miscarriages. So that's something that people don't realize. So some of the symptoms of Hashimoto's are really, you can have either or. You could have the hypo symptoms that I talked about yesterday, or the hyper. So it could be anything from weight gain to weight loss, anything from like sluggishness to like severe anxiety and like always on the go, like hyperactive. You know, you could have palpitations. So you could literally have either or. You could have goiters, you know, seriously, it's like you just really don't know. So it kind of sucks that way. It's kind of like a guessing game. And so if you were to look at your thyroid cells under a microscope, that one that had Hashimoto's, it would be a big clump of like white cells, white blood cells. So it's like thyroiditis, it's the itis. So you got to think about it like bronchitis, appendicitis. It's like an infection. It's like an inflammation. So that's how I think of it. And basically, I was talking in a previous video about some of the tests that people should ask, because, you know, they go to the doctor and all the doctors usually test is your TSH. And that's, people are underdiagnosed all the time, because if all you're testing is a TSH, that's bogus. Like, you can't just go by that. And as I mentioned previously, I had a normal TSH for years. And that hypothyroidism actually probably went into Hashimoto's, because I was undertreated and misdiagnosed for years. Like, I'm talking like 20 plus years, even though I had all the symptoms. So I just, you know, I beg of everybody, if you feel like something ain't right with your thyroid, just keep following up, you know, just keep hounding the doctors. And more importantly, go in there with the information. I feel like most doctors, if you go in there and you say, listen, can you do this test, because blah, 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 I've been doing my research, blah, 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 they will listen to you, most likely. So you want to make sure that you get your TSH, you want to get your T3, T4, you want to get antibodies, and you want to, hold on, I wrote it down because I didn't want to forget. Yes, I'm a nerd, I don't care. So you want to make sure that you get your TPO antibodies, and then you want to make sure you get your thyroglobulin antibodies, because some people will have a certain type of antibodies and other people will have a different type of antibody. So again, you could be, you know, misdiagnosed. So free T3, free T4, TSH, and your antibodies. And reverse T3, sometimes people do, but not as much. So those are the tests that you want to make sure that you get. And so Hashimoto's, you can actually heal. I mean, you can heal your Hashimoto's thyroiditis. You can heal it by, oh my gosh, this is the worst, by like not doing like tons of cardio. Seriously, I probably messed up my thyroid too, because all I did was run and do cardio and like crazy shit for like ever. Like, I was obsessed with like cardio, and so that damages your thyroid too, and it damages your adrenal glands too, which is a whole nother subject. But so you can actually heal your Hashimoto's by, you know, proper diet, nutrition, taking care of yourself, like getting enough sleep, decreasing the stress in your life. I know, easier said than done. So it's just like any kind of inflammation or any kind of infection you can treat, you know, but honestly, the way you treat Hashimoto's is just becoming educated. And, you know, they talk to, you know, I've been educated so many times, and I just pick and choose what I want to listen to anyways. But I can tell you for a fact that I could, back when I was doing like crazy cardio and crazy running and stuff like that, I could tell a difference in my body. My body was mad at me. It's like, hello, you know, you're overworking me. So like weight training, stretching, yoga, things like Pilates, even like HIIT training, which is high intensity interval training. You know, you do like quick bursts of like cardio. That's actually the way to go. And actually, to this day, now knowing that my thyroid, obviously I don't have a thyroid, but knowing that I suffer from thyroid crap for the rest of my life, that's actually something I'm working on too. Like, for instance, tomorrow, yes, I'm going to run 9 miles because I'm training for a half marathon. And you know what's going to really suck is I'm going to feel like shit for the rest of the day. Like, it's going to take me like 2 days to recover. So I don't know why I do that to myself. I'm literally preaching to you guys, but I'm just telling you, it's true. So if you overwork your body, like, it's gonna get mad at you and it's gonna tell you. So if you have thyroid disease, or God forbid thyroid cancer, and you know, you're dealing with some of the crap that I've gone through, just listen to your body and listen to me. I mean, most people don't like cardio anyway, so it's not really like a huge issue, but I don't know, I just have this thing. It's like my therapy. I like to do cardio. I like to run. So, oh my God, Derek, I'm doing a live video, so do not come into it. My husband, I'm telling you. First he's singing, so I come into the bedroom.
I was singing.
See, yeah, so now he's gonna walk by and embarrass me. Oh my God. So anyways, so real life, yeah, now he's gonna go get undressed in front of everybody. Oh God. All right, so another thing is, I'm literally like wicked embarrassed right now. I can't stand it. So another thing that predisposes you to Hashimoto's, he's got me all jumbled, is Caucasian people are actually more predisposed. And Japanese, I can't stand him. Get out of here. So Caucasian and Japanese versus like Mexican and African American descent. So, you know, so we're more at risk. Derek, I can see you in the TV. Everyone can see you in the TV, so don't do anything stupid like take off your clothes. Oh my God. So let's sum this video up, because apparently I cannot live in my house without any kind of privacy. So I usually follow up my videos with like a quick little blog to talk about like a condensed version of what I'm just talking about. Oh, Patricia Hayes, Pat Hayes from Life Care says hi.
Hi.
He says hi, Pat. I don't know if you heard him. Oh, he's so annoying. Yes, Pat, he's still annoying me after all these years. Seriously. So, I think I touched upon everything that I wanted to. So basically, what is Hashimoto's? It's an autoimmune disease. It's an inflammation of the thyroid. Some of the symptoms would be hypo or hyper symptoms. You are predisposed if you are hormonal, if you are a female, in other words, puberty, pregnancy, menopause. You can kind of heal it if you, sometimes with medication, sometimes they'll put you on medication too to kind of shrink it, shrink the thyroid. So you can do that. Proper nutrition, proper rest, less stress in your life. Less stress, people. I know, me. I'm telling everyone, don't be stressed. And what else? So that's kind of the synopsis. Predisposition genetics, if you have someone in your family, and if you're a white person like me, or Japanese, you are predisposed, and if you are African descent, my husband, and or Mexican, then you're at lower risk, according to the literature. And just make sure, if you feel like something could be wrong with your thyroid, make sure you're checking your neck, because I preached about that yesterday. Next month is Thyroid Cancer Awareness Month. You can turn your neck back like this with a sip of water, look in the mirror. If you feel like something's enlarged, you should definitely follow up with your doctor. And make sure you get your test done. TSH is not sufficient. If your doctor tells you, sorry, your TSH is normal, there's nothing wrong with your thyroid, you need to push further. Say, well, I would like to have TPO, thyroglobulin antibodies. I would like to have a free T3, a free T4, and sometimes they do a reverse T3, because I would like to get a whole picture of what my thyroid looks like. So that's a little bit of the synopsis, and I think I touched upon everything. I made notes. Yes, I did. I always make notes. And I think that's it. Have you ever heard of Yes, I have. I was on levothyroxine for a little while, and actually the reason why I stopped taking that particular medication was it didn't work for me. I'm wicked sensitive to fillers, and levothyroxine is like probably one of the least natural thyroid medications. It has a lot of fillers in it, and I'm like wicked sensitive to medication. I'm wicked sensitive to anything. What, Derek?
It's generic.
It's generic, Derek says. So anyways, that's true. So, oh, you're on it? Well, do you feel like your symptoms are controlled or not? Because if not, then that might not be the medication for you. Just because it's a thyroid medicine does not mean it's the right medication for you. The medication that I'm on is called WP thyroid, and yeah, 100 mics, that's actually not even a huge dose, but I think I was on that. I switched medicines so many times before I found a therapeutic dose that I don't even remember what dose I was on, but I'm on WP thyroid, which is, I don't know if you saw a video of mine previously, but it's one of the most natural forms of thyroid replacement. It's made out of, I want to say pork thyroid, and it's natural. It doesn't have any fillers. Like, and it's got T3 and T4, which is what you need in your thyroid. So basically, you need to convert T4 to T3. So if you don't have, some people don't convert it properly. So you might be on just a T4, and that's not sufficient for you. So
Do they still have the thyroid?
you still feel tired and sluggish. So honestly, Jerome, then you're not therapeutic. Like, have you probably have you had a TSH drawn lately? Maybe not. So I would say, check in with your doctor and say, listen, I'm on levothyroxine. I don't know how long you've been on it. I'm on levothyroxine. I still don't feel therapeutic. Now, mind you, it takes about 6 to 8 weeks for the medication to kind of kick in and for any change to happen. So, you know, it might not just be that you've hit that 6 to 8 week mark, but at the same time, if you've been on it for a while, I think you actually told me how long, but I can't see it because it moved up. But then it's not the right medication for you. And I would say, listen, is there any way, oh, thank you. Is there any way that you could check a whole thyroid panel? Like, you know, a TSH, TPO, thyroglobulin, T3, and T4. And then also, if you have an enlarged thyroid, Jerome, make sure you look in the mirror, like I said. Like, tilt your neck back and take a sip of water. If you see anything enlarged here, then, you know, I would follow up, and you can talk to your doctor about possibly getting an ultrasound, because that would be the next step. 6 months back. Oh, then yeah, then you should be feeling well. It could be that you're not on a high enough dose, but it could just also be that your medication is not the right medication for you. I have to be honest, I'm very partial to generic medicine. I feel like, I mean, everybody's different, but I just did not respond well to artificial anything. Like, it's probably because I'm so in tune to my body too, but I'm like a preacher of natural. If you can get natural, go for it, as long as it's not against your religion or anything like that, for like pork or cow thyroid. So, you know, some people it's against their religion, so that would be the other you know, stopping point. But my husband's laying on the bed staring at me, so annoying.
You're so beautiful.
Yes, he says I'm beautiful. So yeah, so Jerome, I would say get your test done again. Be a nuisance to your doctor. Make sure you ask for the test that I told you to. And then, you know, whether it's an increase of the levothyroxine or, you know, trying a different medicine. And I'm assuming you went on it for your labs being off or your symptoms. I'm not really sure. But make sure you follow up. And I'm going to be doing videos more often regarding thyroid health and stuff like that. So definitely will follow up. And you can always message me too. But I think I'm coming to an end. I'm going to probably get off. So I think I touched upon everything I wanted to. Looking at my notes. And yeah. So check me out tomorrow, guys, because I'll be back. So yeah, he was concerned. Okay. So concerned with like your symptoms, or concerned because your TSH was off, like really high? And a lot of times you could have Hashimoto's, honestly, because a lot of times what happens is your TSH is normal for such a long time, and then you're undertreated and you're not treated with thyroid medicine because they're just like thinking your symptoms are like made up, or you're just depressed or blah, blah, blah. You're just tired. And then what happens is when you finally go to get tested again, you actually have Hashimoto's and your TSH is through the roof. So I'm just curious, do you remember what your TSH was? Because you could be definitely a Hashimoto's. So you could be that 7-to-1 ratio, because usually, you know, one man to 7 women have Hashimoto's. So you could be the exception. So not to say that's a good thing, but I'm definitely glad you're tuning into my video, and I'm hoping that you're learning stuff. I said, actually, when I became a nurse practitioner, I was like, I'm going to preach about thyroid forever, and I'm going to be a huge advocate, because I feel like it's like the most undertreated condition, like everywhere, because I just feel like people aren't knowledgeable. Not to say that people are stupid by any means, but, you know, it's just something you don't think about that much. You know, you focus on diabetes endocrinology, but you don't focus on thyroid as much. And your thyroid literally regulates everything in your body. It's like your thermostat. Just ask my husband. He knows, because I complain all the time about everything. So I blame my thyroid, or lack thereof, on everything. And he has to live with me. Oh well, he chose to marry me, so he's stuck with me, right? All right, guys, so I'm going to get going. I hope everyone has a wonderful evening. And I'm going to post it on my Facebook so you guys can catch the beginning. And I'm going to follow up with a blog. And, yeah, spoken medical terms. Exactly. That's why you need to go see a nurse practitioner, Jerome. No disrespect, but... or let me know, and I'll help you kind of differentiate some stuff, all right? But I'm going to get going, and I'll hop on tomorrow, and I usually follow up with a blog at some point, too. So you guys can check that out later. Okay. Happy Friday. I'm going to get some pizza. That's bad. Oh, well, I don't care. It's all about moderation. I'm going to go get some pickle pizza with my daughter. All right. Bye, guys.